Well, many Americans have started dealing with hair loss the last few months. Dr. Richard Chaffoo is here to explain the spike. Is this why I've been losing my hair? I went like this in the shower. I was like, whoa, what is this?
Probably, Shawley. This is a very stressful time for people right now, as you know, with the pandemic. And we know that stress is a major factor in causing a medical term called telogen effluvium or shock loss. And it's that shock loss that we see, unfortunately, that causes excess shedding. So patients might notice that, in the shower. They might notice that when they're brushing or combing their hair. And it's very stressful.
It is stressful, but is this permanent? Is this just a COVID pandemic
So,
stressful thing?
so it's probably a COVID pandemic thing. Researchers have said that the level of stress that we're having right now is actually greater than the recession that we had back in 2009.
Wow.
And of course, it's relatively prolonged. And we know that shock loss, stress is a major factor of that. We also see that in women postpartum. A few weeks after they have their child, there's a temporary shedding of hair. So there are many causes, chronic illnesses, but stress being a major factor that we're all seeing a lot of right now, unfortunately.
Okay, so for the people whose the hair loss is not permanent, what can we do right now to stop and reduce it? And I didn't even think I was stressing out. I think I'm handling this just a-okay.
Well, I think we're doing the best that we can. I think the most important thing is self-care, taking care of ourselves, which means things like, eating a well-balanced meal, well-balanced diet with a lot of protein. Obviously, you want exercise. We know exercise is a great stress reducer because some of the stresses in our lives we can't completely eliminate. And then just that self-care, getting plenty of rest, avoiding a lot of nicotine, caffeine products. Those are factors that are the most important at this point. And realizing it's a temporary phenomenon. Once the stress clears up, in a matter of months, we should see that hair return.
A matter of months. So if you're one of those that the hair is not going to come back and it's permanent, then what do we do?
Yeah, of course, we see a lot of these in our practice, it can be from stress or, female or male pattern hair loss. And there are procedures that can be done. There's something called FUE or follicular unit extraction. We have, right behind me, a robot actually called the Artis IX, the newest robot that's designed specifically for hair restoration. So it allows us to individually remove follicles from areas along the sides and back of the scalp with the assistance of a robot and a camera housed within the robot device, and then take those grafts and permanently transplant them into areas where we've lost hair. And it's a permanent change, so that the hair will continue to grow throughout one's lifetime. And the areas behind there's no long scar. It's a procedure that can be done easily in our office, and patients have a very short recovery. And it's a permanent change in one's appearance. So in those patients where you lose hair and it's not going to come back, it's a very good option to consider.
All right, Dr. Richard Chaffoo, I'll think about that next time I lose like a clump of my hair. Maybe I need to, see? There
it is.
I'll exercise more. Thank you, Dr. Chaffoo.
There you go. Sure, good to see you, Shawley.
Good to see you. The county